The job description of a medical coder revolves around transforming healthcare information into standardized codes that are used for billing, insurance claims, and healthcare records management. Medical coders play an essential role in ensuring that healthcare providers are properly reimbursed for their services and that patient records are accurately maintained. This position is critical in hospitals, clinics, insurance companies, and other healthcare organizations. Medical coders work with patient records, analyzing medical reports, diagnoses, procedures, and treatments documented by healthcare providers. They assign standardized codes using internationally recognized coding systems such as ICD, International Classification of Diseases, CPT, Current Procedural Terminology, and HCPCS, Healthcare Common Procedure Coding System. These codes are essential for billing insurance companies, maintaining patient records, and conducting medical research. Accuracy and compliance are crucial in this role. Medical coders must ensure that codes accurately reflect the services provided while adhering to regulatory standards, such as those set by the Centers for Medicare and Medicaid Services, CMS, and the Health Insurance Portability and Accountability Act, HIPAA. Coding errors can lead to claim rejections, payment delays, or even legal issues for healthcare providers. Primary responsibilities of a medical coder. Medical coders are responsible for reviewing patient records and translating medical terminology into standardized codes. This process begins with analyzing patient documents, including physician notes, diagnostic test results, surgical reports, and discharge summaries. Coders must understand medical terminology, anatomy, and disease processes to ensure accurate code assignment. Once the information is analyzed, medical coders assign the appropriate ICD, CPT, and HCPCS codes for diagnoses, treatments, procedures, and services. They must ensure that the codes are accurate, specific, and compliant with coding guidelines. This includes following coding conventions, identifying modifiers when necessary, and avoiding unbundling or upcoding practices. Medical coders also collaborate with healthcare providers to clarify any ambiguities in patient records. If documentation is unclear, they may contact physicians or healthcare staff to request additional information or corrections. This ensures that coded information is accurate and complete, reducing the risk of claim denials. Another key responsibility is maintaining up-to-date knowledge of coding guidelines and industry regulations. Medical coders must stay informed about changes to coding systems, new codes, or revised guidelines issued by coding authorities such as the American Medical Association, AMA, and the World Health Organization, WHO. Medical coders are also responsible for conducting quality checks to ensure coding accuracy. They may participate in audits, review their own work, or assist with peer reviews. This focus on quality helps maintain compliance with healthcare regulations and reduces the risk of coding errors. Essential skills and qualifications for medical coders. The job description of a medical coder emphasizes the importance of a strong understanding of medical terminology, anatomy, and physiology. Coders must be able to accurately interpret complex medical information and assign the correct codes. Attention to detail is a critical skill. Even a minor coding error can lead to incorrect billing, claim denials, or compliance violations. Medical coders must carefully review patient records and ensure that all codes are accurate and properly documented. Analytical skills are essential for identifying and applying the correct codes. Coders must understand how to read and interpret clinical documentation, recognize disease processes, and determine the appropriate coding options. Communication skills are also important. Medical coders must effectively communicate with healthcare providers to clarify documentation, resolve coding questions, and ensure coding accuracy. This may involve explaining coding rules or requesting additional information. Technical proficiency is necessary, as most medical coding is performed using electronic health record (EHR) systems and coding software. Medical coders should be comfortable working with medical billing software, coding tools, and digital documentation systems. Professional certifications can enhance job prospects. Popular certifications include the Certified Professional Coder (CPC) from the American Academy of Professional Coders (AAPC) and the Certified Coding Specialist (CCS) from the American Health Information Management Association (AHIMA). These credentials demonstrate expertise in medical coding and increase career opportunities. Work environment and challenges. Medical coders typically work in a variety of healthcare settings, including hospitals, outpatient clinics, physician offices, insurance companies, and remote coding services. Some coders work on-site, while others work remotely, especially with the growing demand for telehealth and digital health services. The job can be mentally demanding, requiring continuous focus and concentration. Medical coders must maintain a high level of accuracy while working with large volumes of patient records. Coding errors can have significant financial and legal consequences, making attention to detail essential. Coders may also face challenges related to unclear or incomplete documentation. In such cases, they must communicate with healthcare providers to obtain clarification or additional details. This requires strong interpersonal skills and a commitment to maintaining professional relationships. Compliance with regulatory guidelines is another challenge. Medical coders must ensure that their work adheres to federal and state regulations, as well as organizational policies. Regular updates to coding systems and guidelines require coders to stay informed and adapt quickly. Career development and growth opportunities. The job description of a medical coder offers various career advancement opportunities. With experience, coders can progress to roles such as senior medical coder, coding auditor, medical coding supervisor, or health information manager, specializing in specific areas of medical coding, such as inpatient coding, outpatient coding, or risk adjustment coding, can enhance career prospects. Advanced certifications, such as Certified Inpatient Coder, CIC, or Certified Risk Adjustment Coder, CRC, can open doors to higher-level positions. Medical coders may also transition into related roles, such as Medical Billing Specialist, Healthcare Compliance Officer, or Clinical Documentation Improvement Specialist. Pursuing further education in health information management, healthcare administration, or nursing can expand career options. Conclusion. The job description of a medical coder highlights a role that is both detail-oriented and impactful. Medical coders ensure that healthcare providers receive proper reimbursement for their services while maintaining accurate patient records. Their work supports the financial health of healthcare organizations and contributes to data-driven healthcare management. For individuals with strong analytical skills, a keen eye for detail, and a passion for healthcare, this role offers a rewarding career path. Whether working in hospitals, insurance companies, or remote coding services, medical coders are essential to the efficient and accurate management of healthcare information.